Hello, my name is Hannah Baker, and today we're going to be discussing the psychotherapeutic techniques for distressing memories, a comparative study between EMDR, brain spotting, and body scan meditation. I chose this study because I have been working in PTSD and trauma therapy at my field placement, and I have a couple providers there who practice EMDR. So one of them is my supervisor at my site. So it's been interesting to hear about how the EMDR sessions are going. Um, we often discuss brain spotting at my clinic, but I haven't really seen it been done. I've just researched some stuff about it, so I was more interested in the comparison between the different interventions here in the study and how it could assist in distressing memories. So the type of study that was completed was a quantitative study. They did interviews with participants of psychologists and medical doctors. So what they did is they had the psychologists and medical doctors report 4 distressing memories, and then each of which was treated with a single intervention. So EMDR, BSP, brain spotting, and body scan meditation were compared with each other, and with a book rating, which is BR, active control condition using a dependent measure, SUD, subjective units of disturbance, and memory telling duration, MTD, on a 4-point timeline. And this article often uses these acronyms throughout, so that is what I will use for the rest of this recap as I'm going through this information. It goes on to say that at post-intervention and follow-up, EMDR and BSP SUD scores were significantly lower than BSM and BR scores. At both post-intervention and follow-up, BSM SUD scores were lower than the BR scores. A reduction in MTD was observed from pre to post-intervention for EMDR and BSP conditions. So the kind of conclusion of the study, which we will get more into later, is overall results showed beneficial effects of single sessions of EMDR, BSP, or BSM in the processing of healthy adults' distressing memories. And I will go on to my next slide. And that kind of brings me to the research question the study was seeking to answer. So the aim of the current study was to explore and compare the effects of a single 40-minute session of EMDR, BSP, and BSM techniques in the processing of distressing memories, shown by a non-clinical sample of adult participants, medical doctors or psychologists in training and psychotherapists. So I thought this was interesting to the study, especially since they chose trained medical professionals, and it turns out that they wanted to get a sample that was reducing any potential negative side effects. They wanted to, avoid severe psychopathology, capacity of participants, and self-focusing on their inner experience. They just wanted the participants to be able to process the possible adverse side effects of possibly having to go through distressing memories. And I think that because a non-clinical sample was chosen, they wanted to find people who wouldn't affect the study as much if they were to experience negative emotions after the fact, which could cloud the study answers, especially since they're taking information of how these medical professionals are experiencing the effects of these sessions of the EMDR, the brain spotting, and the body scanning meditation. I think it would be really important to make sure that they are in a serene state of mind. And I think psychologists and medical doctors are trained to deal with traumatic incidences And yeah, so that is the research question the study was seeking to answer. So they wanted to compare what EMDR, BSP, and BSM uh, would do um, in the process of experiencing distressing memories. So they wanted to see how each of the different um, interventions assisted the distressing memory, and then the individuals would be led through the distressing memory as well as the intervention. So, without getting into too much of what the interventions do, uh, the 40-minute EMDR session would be a little bit different than the brain spotting and the BSM sessions. The body scanning meditation is different as well. So, just depending on the technique, they wanted to know which would be better for clients to go through the distressing memories and to continue experiencing it. And then that, in effect, will lessen the power that the event has over the person. Um, and they wanted to see what would be the best treatment. Also, if the treatment is going to be successful. So I think that is why they chose the non-clinical sample. The hypothesis that they were going for is that these techniques, these EMDR, BSP, and BSM techniques, are going to be helpful in the processing of distressing memories, um, and that they would show that they would be beneficial in any sort of psychological treatment. The null hypothesis can be looked at when you look at the limitations. I think the limitations, as explained, the small sample size and the specificity of the study population should be considered. So yes, participants were psychologists and medical doctors, so they have a lot of information about psychotherapy. They have a lot of their different beliefs and a lot of different ways that they personally think about psychology. And maybe they have their own biases or even experiences with EMDR, brain spotting, or body meditation. So it could lead to an effective result of the study, especially if they are um, clinicians or psychologists who are in the same field, or perhaps they all are experiencing clients who are dealing with trauma, and so they are looking for a solution for it. So they would then maybe amplify if the study is better. Maybe they would say that the study is better than they think it is because they want that to be true. That could be a bias that they have in their personal experience. So I do think that one of the null hypotheses, one of the null hypotheses that they had in the article was also talking about how this could be directly off of bias coming from individuals who are in the medical field. So yes, there are limitations in the study, but overall the study was very tangible and focused on the experiences of doing the 40-minute sessions and having different distressing memories during each of the different kinds, the EMDR, the brain spotting, and the body meditation. And I think that is what led to a greater area of research, especially since they decided to do comparisons of all three of them. And as said in the first slide, there was in the conclusion, there is a greater chance of success using EMDR, and there is success as well using brain spotting and body meditation, but there is greater success of using EMDR as an intervention. And so, yeah, that brings me to conclusion. So what they stated in that conclusion is that the research produced relevant results showing the beneficial effects of single 40-minute sessions of EMDR, BSP, or BSM on non-clinical individuals processing of distressing memories. We found that EMDR and BSP were comparable in terms of efficacy and similarly affected how the distressing memories were reported in terms of conciseness. These results were primarily attributed to the central role of paying attention with equanimity to one's body sensations during memory processing. So their hypothesis was proven true due to this quantitative study. The research did produce results showing there are beneficial effects of these single 40-minute sessions of EMDR, BSP, and BSM. They said that EMDR, BSP were comparable, and they were used effectively to relay distressing memories. And as they said, that they were reported in better terms of conciseness. So the brain was able to lessen one's body sensations and have traumatic memories can go through the body. These sessions were able to kind of lessen the body sensations during the memory processing, so they were able to concisely explain what the traumatic event was and how they are then able to kind of go through the distressing memory themselves. And of course, with time, there has been evidence-based research to show that EMDR, brain spotting, and body scanning meditation does work with traumatic memories. So they wanted to focus on the 40-minute sessions, making sure that they added more evidence base to the fact that these do work in traumatic memory settings, and that they are backed by science and quantitative evidence showing that it does work on non-clinical individuals. I think it would be non-ethical to try to do a study like this on individuals who are clinical, because we don't want to see distressing memories causing negative consequences for individuals who may sign up to be part of these studies. And I think that EMDR, brain spotting, and body scanning meditations can work, but it does take time to work. And I think getting individuals who are maybe in a better state of mind, or maybe who do not suffer themselves from mental health disabilities, is something that was an aid to this study, as it shows that it's not, hopefully it didn't cause harm in the individuals that were part of the study, and that's why they chose non-clinical individuals. So yes, overall the study did work and the hypothesis was supported. I think that this study is important to mental health care, medical health care, as we are currently going through our own version of generational trauma because of the coronavirus pandemic. We are all going through our own versions of trauma on an everyday basis, but there are as well marginalized communities who have experienced trauma on a clinical basis, who these interventions could really help with. And at the end of the day, I think studies like this are really important to show how maybe some interventions that are not as popular right now are going to be popular in the future, especially body scanning meditations, maybe more holistic forms of interventions instead of medicinal interventions. So yeah, thank you so much for listening to me discuss about these psychotherapeutic techniques for distressing memories, a comparative study between brain spotting, body scan meditation, and EMDR. And have a good day.